Mr. Khan.
Mr. President.
The Leader of the Opposition.
Mr. President, I rise to speak in support of the Voluntary Assisted Dying Bill 2017. This bill establishes, in the safest, most protective way provided by any like regime that I am aware of, the right for certainly terminally ill persons to request and receive assistance to end their lives voluntarily with medical help by the administration of a lethal substance. Importantly, the patient must take the final step themselves. The capacity for a spouse, family member or friend to administer the lethal substance, present in an early draft, is not present in this bill. A patient seeking assistance will be required to self-administer. Where a patient is unable to do so, only a qualified doctor or nurse can assist. Medical practitioners, health facilities or healthcare providers have the right under this bill to conscientiously object to providing assistance. This legislation touches on a most difficult social, legal and personal issue because it goes to what remains in our society a great taboo, a frank discussion about death, about the end of life in circumstances often involving pain and great suffering for individuals and for their families. Any debate, whether in our society or in a chamber of parliament, on this matter of conscience will be a little raw and difficult for participants and for anyone listening. Like many others, I do not come to this debate with a completely open mind. Although this is a matter of conscience and members in this place will be able to exercise a vote not constrained or dictated by party, we all come to this matter shaped by our own lives and our own experiences. In 2013, when we last debated and voted on a matter of this kind, although I voted in favour of it, I was still tentative and a little bit uncertain. But the more I read, the more I talk to people, whether they are laypersons or experts, the more certain I become that a measure of this kind is not only necessary and right, but is the best way to reduce suffering. I note that individual members in this place bring their own social, philosophical and indeed, as one of the previous speakers noted, religious sensitivities to this debate, and I respect that. It is important when we debate matters of conscience that whatever our own views, we are respectful to one another and to those outside this place in relation to those differences of opinion. If we conduct ourselves in that way on matters like this, we will be exhibiting Parliament at its best. Australia was the first place in the world to pass a law giving terminally ill people the legal right to be helped to die in 1996 in the Northern Territory. But with only 4 people being able to use the law, it was rendered inoperative the next year by the federal parliament on the proposal of the Howard government. That was over 20 years ago. Since then, the organisation Go Gentle stated in 2016 that there had been 28 unsuccessful attempts to pass a similar law in various Australian states. A 29th attempt is underway in Victoria. This, I think, is the 30th. Over that time, opinion polls in this country have continued to show overwhelming and growing support, at 85% now, for assisted dying to allow for better choice at the end of life. It is perhaps worth noting that surveys on the matter consistently show high levels of support, even amongst those persons who are religious. A national news poll survey in 2012, for example, showed that 88% of Anglicans and 77% of Catholics agreed that a doctor should be allowed to meet a request from a hopelessly ill patient for assistance to die. So I note the Honourable Lou Amato's earlier contribution where he noted that division of opinion is divided in the community. Yes, there is differences of opinion, but I do believe that a consensus has emerged. Like the majority of Australians, I believe that terminally ill persons should have the right to choose a dignified end to their life. The alternative, which we now have, is that many are condemned to suffer extreme and often prolonged physical and psychological pain, pain for which there is often no relief. Death is complicated and difficult, and we as a society are not good at talking about the end of life. We do not want to have to face it, we shy away from dealing with it. But there are many people who do not have the luxury of a choice in the matter. They are not suicidal. We are not discussing assisted suicide. Suicide is where a person wants to die. The people whose suffering we are discussing today do not want to die. They are dying anyway. The prospect of doing so, of that journey of pain, of loss of autonomy, loss of dignity and loss of quality of life can fill those involved with terror and misery. Surely those facing this prospect deserve to be able to exercise control over how much they suffer as they near the end of their life. Death is unavoidable, but we can decide to treat those who are dying with more compassion and allow them more choice. I believe we can no longer ignore giving those patients whose death is close the right to ask for help if their suffering becomes unbearable and untreatable, to have a choice about what happens to them at the end of their lives, to choose to go a little earlier, peacefully and on their own terms. Regardless of your views, this debate is about respect. It is about compassion. It requires empathy and it requires courage. It can be painful, very painful, to watch someone you love endure those last weeks and last days. For those many who have experienced it, it is not something that can ever be forgotten or indeed recovered from. We have heard many stories of those who have watched their loved ones die in debilitating agony and in fear. Like many, my own views have been shaped not only by what I have read and what I've heard, but from my own lived experience. My father died of cancer over a 6-month period. The treatment of his pain was not always successful or came at the cost of life quality. The best treatment he had, medicinal cannabis, is still not legally available in this state today. I note this Parliament has recently rejected measures to address that problem. My uncle died of motor neurone disease over a 2-year period. Had he not lost the use of his arms, he would have taken his own life. In his last days, he begged his wife and my mother to help him to die. They, of course, did not. He slowly suffocated and then drowned as a result of his illness. But while he suffered, he was not in pain that could be treated. Morphine wasn't needed. His end was terrible. A close family friend living in Switzerland recently died from ovarian cancer. Anyone who knows about that illness knows how dreadful and untreatable it is at the end. While she was registered with the well-known facility Exit, she was unable to access its services. Her health deteriorated so fast that treatment of her pain with morphine meant she was in and out of consciousness and therefore could not satisfy the requirements of being of sound mind or informed consent. This should give those in this place who have reservations about this bill comfort that the legal frameworks around assisted dying do work. Nevertheless, knowing that the option existed provided significant comfort for her and her husband during her last months. Many people have similar stories about the passing of their loved ones. Without better options available to them, without the peace of mind of a painless death, people are left to resort to using often painful and sometimes unsuccessful ways to end their lives before enduring more pain and suffering. Assisted dying is already happening in Australia, but without proper regulation, oversight and accountability. This is also unsatisfactory and dangerous. We should regulate the process to make it available for all who need it in a proper, safe, medically supervised way. That is what I've heard from medical practitioners, nurses and those practising palliative care. As the Honourable Walt Secord noted, the medical and allied healthcare professionals are divided on this issue, as is the wider community, although I believe there is very high public support. In this matter, I'm guided by what I believe, based on the available evidence, will result in less suffering. In undertaking this task, we are fortunate to have the benefit of knowledge and experience from overseas to draw on. United States, states such as Oregon, countries such as Canada, Belgium, Switzerland and the Netherlands. We know what works and what does not, the strengths, weaknesses and controls from these long-running systems and years of their thorough study and review, as well as debate from all sectors of the community and those involved in the process. We can take the best parts of all of these approaches to create the best law and practices available. This bill is a result of the efforts of the New South Wales Parliamentary Working Group on Assisted Dying, a group of MPs across parties and houses and many in the community who contributed to the process. I commend the honourable members of the working group who have worked diligently and conscientiously on the construction of this bill for 2 years, ensuring the most safeguarded eligibility criteria and process for requesting this assistance than in any other proposal of its kind. It is careful and measured, it is reasonable, and it is extremely well supported by evidence. It means, I believe, the risks that are said to be reasons for not implementing assisted dying legislation, of exploitation and pressure being brought to bear on the aged, the disabled, those living with mental or health or persons who are otherwise vulnerable, are simply not present in the bill before this House. To die through the processes offered in this proposal, an affected person really has to want to avail themselves of it. For those honourable members concerned with the magnitude of this decision, and some have said this bill is about life and death, please be aware that this is not a new thing for us as a Parliament. We do it all the time. Each time we allow a budget to pass without adequate funding for life-saving measures, for example in our health system, whether it be palliative care or mental health services, we permit life and death to be in the balance whether we want to acknowledge it or not. Perhaps a more direct and recent example is the Terrorism Legislation Amendment, Police Powers and Parole Bill 2017, which confirmed in certain circumstances the right of police officers to shoot to kill. Honourable members should read the contributions made in that debate. I stand by my vote in that matter, but unlike that legislation, this bill does not authorise one person to take the life of another. What it does do is it permits a person facing the end of their life to take control and to depart on their own terms. I understand there are those who are fundamentally opposed to the legalisation of assisted dying. I respect that. No clauses placed in legislation will be able to meet their concerns. However, we must not simply raise endless hypothetical scenarios about things that could happen under these laws as proof that it can't ever be safe. Canadian Justice Lynn Smith confronted this in her landmark 2012 decision that paved the way for assisted dying laws to be introduced in her country. She said, and I quote, "It is unethical to refuse to relieve the suffering of a patient who requests and requires such relief simply in order to protect other hypothetical patients from hypothetical harm," unquote. I agree wholeheartedly. I will address two of the main groups of arguments often raised to argue against voluntary assisted dying, so that the public debate is not perpetuated by myths and misconceptions around this critically important issue. We've heard the argument that voluntary assisted dying is a slippery slope that threatens the disabled, the elderly, the vulnerable, and can affect society's belief in the sanctity of life and indeed lead to mission creep. This theory warns that legalising voluntary assisted dying would lead to more people than intended pursuing this avenue, that it would expose the most vulnerable, people with disability, dementia patients and the very frail, to an increased risk of assisted dying through coercion, the belief they are not valued in society or by being made to feel they have become a burden. Let's be real about this. There is simply no evidence in the jurisdictions that have legalised assisted dying that would give anyone any concerns that the elderly, the disabled or the vulnerable are more at risk and have been prevailed upon to depart earlier. There is no evidence to that effect. Opponents also argue that such legalisation would foster a cultural shift in our society towards devaluing human life and implicitly condone life-ending acts that could lead to doctors or family members feeling justified in ending life without explicit consent. But again, there is simply no credible evidence of any increase in the incidence of life-ending acts outside the legal framework and as a result of laws being implemented in those jurisdictions. The fundamental safeguards in the bill outlined by the Honourable Trevor Khan, such as the strict eligibility criteria and the required sign-off by 2 medical practitioners and an independent qualified psychiatrist or clinical psychologist, subject also to applications by close relatives to the Supreme Court of this state, should satisfy persons that fears of such slippery slope theories becoming a reality under this legislation are misplaced. The argument of mission creep that eligibility criteria will over time be widened based on overseas experience, I would remind honourable members that in those countries it has been governments that have implemented and driven the initial laws as well as the changes. In our context, these laws are appropriately the result of non-partisan and free votes exercised by members of Parliament. I think that is an important safeguard that should provide additional comfort to those in this chamber and the wider community. I urge honourable members to make their decision today on what is in the bill, not what could be proposed down the track in 10 years or 20 years. Secondly, there is a myth that palliative care can relieve all suffering. Now, I am firmly in favour of significant improvements to the quality of and access to palliative care. That is something that frankly should be done regardless of debate on this bill. While assisted dying is contentious, access to palliative care services should not be. Palliative care is about enhancing the quality of life through health care and support of people with life-limiting illness, provided by and informed by professionals who specialise in this field. It's an essential component of a modern healthcare service and an increasingly important part of the wider health and social care system. However, we know that New South Wales Health approach to planning and evaluating palliative care is not effectively coordinated. There is no overall policy framework for palliative and end-of-life care, nor is there comprehensive monitoring and reporting on services and outcomes. According to the New South Wales Auditor-General in a recent report, quote, New South Wales Health has a limited understanding of the quality and quality of palliative care services across the state, which reduces its ability to plan for future demand and the workforce needed to deliver it. At the district level, planning is sometimes ad hoc and accountability performance is unclear. We also know that funding of much-needed services is not adequate. New South Wales is also painfully short of palliative care specialist doctors and nurses, particularly in rural and regional areas. Everyone who needs palliative care should receive it. No one should be excluded, certainly not because of poor planning or limited funds. Palliative care services in Belgium, Netherlands and Oregon have markedly improved since similar laws were introduced there, and I hope the same will occur here. Whatever happens with this bill, I urge the New South Wales Government to implement in full all of the Auditor-General's recommendations for a better resource, better respected and better valued palliative care systems. Like earlier speakers have identified, the challenge for us is to ensure the government invests more in palliative care, particularly in remote and regional locations. Many in this place and any other place, like the present Treasurer who has written an opinion piece opposing this bill, are in fact in a position to achieve this outcome. I look forward to seeing a massive increase in the funding and availability of palliative and other care options in next year's state budget. But importantly, palliative care does not work for everyone. With terminal illness, there can be suffering for which there is no available relief. Even the best palliative care cannot alleviate all the pain, nausea and extreme discomfort some experience at the end of their lives. The palliative care sector internationally, including Palliative Care Australia, has acknowledged this. As past president of the AMA, Dr. Brendan Nelson put it, there is a small group of patients for whom no amount of medical treatment is going to relieve their suffering. The latest figures from Wollongong University's Health Services Unit, which collects data from 106 palliative care units across Australia, shows that 1/5 of those in the last 24 hours of life died in moderate to severe pain, despite the best efforts of palliative care. But please bear in mind, not all those with a terminal illness are in physical pain, but they lose their autonomy, their control over their lives, and lose access to and enjoyment of all the things that for them makes life worthwhile. When they lose this, and death is already imminent, and the end will be miserable, and usually either painful or involving other great suffering, why should we deny them the choice of avoiding this kind of end? Why are we forcing people in that circumstances, already so vulnerable, to have an uncertain and undignified end to their life? Mr. President, where is the humanity in that? Where is the decency? This bill is all about alleviating that suffering. But let us be clear, this is not a debate about palliative care or voluntary assisted dying. It's about incorporating the option of voluntary assisted dying into our palliative care framework for a more comprehensive service for all patients. Voluntary assisted dying will not diminish palliative care in this state. It will complement it and improve it, as it has done in many jurisdictions where voluntary assisted dying has been legalised. As the man acknowledged, the father of palliative care in Australia, Senior Australian of the Year 2013, Professor Ian Maddox, said, and I quote, "If compassionate and loving care towards patients and families is what palliative care is all about, then assisted dying is part of that. It is time the profession dealt with it," unquote. Mr. President, this bill is about granting terminally ill people a right to make a choice about how they live the final stages of their life and how and when they wish to die. It is an intensely personal matter that no one wants to find themselves or a loved one in a position to have to consider. But the reality is many, many families must do so. It is for them that we should support this bill, so they can decide for themselves what is best for them at that critical time. If terminally ill people are done fighting an unwinnable war, they should be given the opportunity, if they wish, to say they've had enough, to alleviate their physical and mental anguish and distress in the face of further unnecessary suffering and deterioration. The outcome of this debate should be based on sound evidence, well-reasoned arguments, and informed by the wishes of the community, and with the knowledge that this bill has some of the most rigorous safeguards and protections and enforces strong monitoring procedures and levels of compliance to counter the fears of such misconceptions that I have outlined earlier. If you would not use it, you do not have to access this law. But please have the humanity not to deny others the chance to pass away peacefully with dignity in a medically supervised manner. It is not about imposing anything onto any other person. It is simply about making available another palliative care option for those with unbearable terminal suffering. Giving them the option, putting end-of-life decisions back into the hands of already dying patients. That's what this bill is about. A choice for each eligible individual, about that individual, by the individual. Mr. President, that is why I will vote for this bill, because frankly, it should be their choice, not ours.